Vitamins are essential for life. They play countless roles in our body, from boosting immunity to supporting bone health and energy production. Many of us diligently take supplements, believing that if a little is good, then more must be even better. This common belief, however, can be a dangerous misconception. While vitamin deficiencies can lead to serious health problems, so too can excessive intake, particularly from supplements. Our bodies are finely tuned systems, and an imbalance, whether too little or too much, can disrupt their delicate equilibrium. Today, we're going to explore the often overlooked dark side of vitamin consumption. We will uncover the surprising dangers associated with overdoing 8 specific vitamins, revealing why moderation and informed choices are paramount for your health. Understanding these risks is crucial for anyone seeking optimal wellness. The concept of vitamin toxicity or hypervitaminosis is not widely discussed, yet it poses significant health risks. Unlike water-soluble vitamins, which our bodies typically excrete in urine when consumed in excess, fat-soluble vitamins are stored in our tissues. This storage capacity means they can accumulate to toxic levels over time. Even some water-soluble vitamins, when taken in extremely high doses, can overwhelm the body's excretory mechanisms and lead to adverse effects. The dangers we'll discuss primarily stem from supplement use, as it is exceedingly rare to reach toxic levels through diet alone. Food sources naturally regulate intake, whereas concentrated supplements bypass these natural checks. The symptoms of vitamin toxicity can range from mild discomfort to severe, life-threatening conditions. They often mimic other ailments, making diagnosis challenging without a clear understanding of supplement intake. This is why awareness of potential overdose symptoms is so vital for health enthusiasts. Vitamin A is crucial for vision, immune function, and skin health. It's found in foods like carrots, sweet potatoes, and liver. However, as a fat-soluble vitamin, it can accumulate in the body. Excessive intake of preformed vitamin A, often from supplements or certain animal products, can lead to hypervitaminosis A. Symptoms include headaches, dizziness, nausea, and blurred vision. Chronic overconsumption can result in more severe issues. Long-term high doses of vitamin A can cause liver damage, bone pain, and even increase the risk of fractures. Pregnant individuals must be especially cautious, as excessive vitamin A can lead to severe birth defects. Always check supplement labels and consult a healthcare professional. Vitamin D is vital for bone health, calcium absorption, and immune regulation. Our bodies produce it when exposed to sunlight, and it's also found in fatty fish and fortified foods. Vitamin D supplements are widely popular, especially in regions with limited sun exposure. However, vitamin D is also fat-soluble, and excessive supplementation can lead to toxicity, known as hypervitaminosis D. This condition results in hypercalcemia, an unhealthy buildup of calcium in the blood. Symptoms include nausea, vomiting, weakness, and frequent urination. Severe hypercalcemia can cause kidney stones, kidney damage, and even calcification of soft tissues like the heart and blood vessels. While vitamin D deficiency is common, blindly taking high doses without monitoring can be detrimental. Regular blood tests are essential for those on high-dose regimens. Vitamin E is a powerful antioxidant, protecting cells from damage and supporting immune function. It's abundant in nuts, seeds, and vegetable oils. Many people take vitamin E supplements for its purported anti-aging and heart health benefits. While generally considered safe at moderate doses, very high doses of vitamin E, particularly alpha-tocopherol supplements, can pose significant risks. Its anticoagulant properties can become problematic. Excessive vitamin E intake can interfere with blood clotting, increasing the risk of bleeding, especially in individuals taking blood-thinning medications like warfarin. This heightened bleeding risk can lead to hemorrhagic stroke. It's crucial to discuss vitamin E supplementation with a doctor, especially if you have a bleeding disorder or are on medication. Vitamin K is essential for blood clotting and bone health. It's found in leafy green vegetables and produced by gut bacteria. Unlike other fat-soluble vitamins, vitamin K toxicity is rare from dietary sources. The primary danger with vitamin K supplementation arises from its interaction with certain medications. Specifically, high doses of vitamin K can counteract the effects of anticoagulant drugs such as warfarin. This interference can reduce the effectiveness of blood thinners, increasing the risk of dangerous blood clots. Individuals on anticoagulant therapy must maintain a consistent vitamin K intake from food and avoid supplements unless specifically advised by their physician. Balancing vitamin K intake is critical for these patients. Vitamin B3 or niacin is crucial for energy metabolism, DNA repair, and antioxidant activity. It's found in meat, poultry, fish, and nuts. Niacin is sometimes prescribed in high doses to help manage cholesterol levels. However, niacin supplements, especially in the nicotinic acid form, are well known for causing the niacin flush. This involves redness, itching, and a burning sensation on the skin, often accompanied by nausea and dizziness. While usually harmless, it can be very uncomfortable. More serious side effects of high-dose niacin include liver damage, particularly with sustained-release forms, and gastrointestinal upset. It can also worsen conditions like gout and peptic ulcers. Always take niacin under medical supervision, especially for therapeutic purposes. Vitamin B6, or pyridoxine, is vital for brain development, nerve function, and the production of neurotransmitters. It's found in a wide variety of foods, including chickpeas, salmon, and potatoes. Many people take B6 supplements for mood support or to alleviate premenstrual syndrome symptoms. While essential, excessive intake of vitamin B6 from supplements can lead to a specific and concerning form of toxicity. This involves nerve damage, known as peripheral neuropathy. Symptoms of B6 toxicity include numbness, tingling, and pain in the extremities, often starting in the hands and feet. In severe cases, it can lead to difficulty walking and muscle weakness. This damage can be irreversible if high doses are continued. Always adhere to recommended daily allowances for B6. Vitamin C, or ascorbic acid, is a powerful antioxidant, essential for immune function, collagen production, and wound healing. It's widely available in fruits and vegetables like oranges, strawberries, and broccoli. Many people take high doses of vitamin C, believing it prevents colds or boosts overall health. As a water-soluble vitamin, excess vitamin C is generally excreted in urine. However, extremely high doses can still lead to adverse effects. The most common issues are gastrointestinal disturbances. High doses of vitamin C can cause diarrhea, nausea, and abdominal cramps. More significantly, in susceptible individuals, particularly those with a history of kidney stones, excessive vitamin C intake can increase the risk of oxalate kidney stone formation. While rare, it's a concern for those predisposed. Folic acid, or vitamin B9, is crucial for cell growth, DNA synthesis, and red blood cell formation. It's especially important for pregnant individuals to prevent neural tube defects. It's found in leafy greens, legumes, and fortified grains. While essential, excessive folic acid intake from supplements can mask a more serious underlying condition, vitamin B12 deficiency. Both vitamins are involved in red blood cell production, and folic acid can correct the anemia associated with B12 deficiency. However, folic acid does not address the neurological damage caused by BO12 deficiency. By masking the anemia, it can delay the diagnosis and treatment of B12 deficiency, allowing irreversible neurological damage to progress. This is a critical concern, especially for older adults and vegetarians. The message is clear. Vitamins are vital, but more is not always better. The dangers of overdoing these 8 vitamins highlight the critical need for informed choices when it comes to supplementation. Our bodies are designed to obtain most of their necessary nutrients from a balanced and varied diet. Supplements should truly supplement, not replace, a healthy eating pattern. Before adding any high-dose vitamin supplement to your routine, especially those that are fat-soluble or have known interaction risks, consult with a healthcare professional. They can assess your individual needs, potential deficiencies, and any existing health conditions or medications. Understanding recommended dietary allowances and tolerable upper intake levels is also crucial. These guidelines exist to help prevent both deficiencies and toxicities. Do not exceed these limits without professional medical advice. Navigating the world of vitamins and supplements requires knowledge and caution. Remember that the goal is optimal health, which is achieved through balance, not excess. Prioritize a nutrient-rich diet filled with whole foods. This approach naturally provides a spectrum of vitamins and minerals in appropriate amounts. If you suspect a deficiency or have specific health goals that might warrant supplementation, seek personalized guidance. A doctor or registered dietitian can help you determine if a supplement is necessary, what form and dosage are appropriate, and how to monitor for any adverse effects. Your health journey is unique. Empower yourself with accurate information, question the "more is better" mentality, and always put safety first. By respecting the power of vitamins and understanding their potential pitfalls, you can make truly healthier choices for a vibrant and well-balanced life.